information when it was first seen. The Saxon skull was from 7th century, long time ago, 3,000 years ago, was discovered. The skull was related to the Down syndrome child. So there's a little like deformation of the skull that they, based on that, they figure out that the child has the Down syndrome. Who discovered it and where the name came from for the Down syndrome? It was first described by John Down, that's why Down syndrome. It was published, he published that in 1838, a long time ago again, and basically this is how he looked like, very smart guy. Causes, medically, clinically, the reason for Down syndrome is that there is an extra chromosome. And in healthy, normal body, we have 46. In Down syndrome, it results in 47. There's, instead of 2 copies of the chromosome 23, there's 3, and it's circled right there. So this is where the problem starts, this point here. A little risk factors, a little nice chart with showing you that there's really no way to avoid Down syndrome, but the kind of the most obvious reasons are the mother who is exposed to X-ray during the pregnancy, and also parents who are carrying Down syndrome gene, or older mothers. And it shows that after 35 years old, women who get pregnant, they are at higher risk to have Down syndrome baby. I remember I was 32 and I was pregnant with Maya, and they already was doing tests for Down syndrome. But they ask you before 35, they ask you, would you like to be tested for Down syndrome, yes or no? After 35, you do have to. I think it's mandatory. They do that test without you even asking. The effects of chromosome. So we do have intellectual disability. There's a delayed development, personal, social, language, speech, cognitive, gross and fine motor. Basically everything is a little delayed in this child. And the interesting thing is that, you know, the physical characteristics are, they are smaller in the stature. They have the almond eyes shape, and we'll see pictures later. And hypotonia, definitely low muscle tone. Other medical secondary issues with Down syndrome kids are related with heart diseases, respiratory issues, and hearing and sight problems. So we'll come later as well. Here's a little picture of the physical signs of Down syndrome child. And as you see, the face is flat. We've got this almond eyes shape. We've got deep palm creases. Shows right there a little bit like really, it's like way deeper than in your hand or other, you know, normal person. I don't like to say normal. They're normal too, in my opinion. But loose ligaments, that's a big deal. They have this loose ligaments, structures. They have smaller hands compared to their peers, and short neck, so they don't have this distinguished normal neck. And ears. They have a little abnormal ear shape, and then we'll see later, like right here. I was getting this picture last night because when I was going for this, I'm like, ears? Let me check this out. And I pull out this picture, and it does look a little, that it's a little deformed. And another thing with neonatal features, with the brand new baby, there's the pulmotor reflex, and we know what is motor reflex. The baby cannot really flex, you know, when there's a little stimulation put, you know, against the spine from up down. Doesn't have this, the flexion to the lateral flexion. Also, I talk about hypotonia, but also there's like the white spot in the iris of the eyes, and I did pull out the picture to show because I couldn't imagine it too. So it's like, oh, okay. Hyperflexibility of the joints again. I found this and I thought it's really great. You see activity and you see children with Down syndrome and typical children, and you can see how the delay looks like. Let's say respond to the sound. You have a baby Typically, the baby responds, typical baby at 1 month, 0 to 1, and then here's the delay. The baby saying dada and mama. Down syndrome baby will say at 7 months, and typical baby at 4. And you see, like, let's say, first word spoken with meaning, it's 18 months, here's 14, so there's a little delay. Speech, cognitive, social, everything. That shows those few. Growth, body weight, length, height are less compared to typical babies. Definitely there's a decreased rate of growth. And the weight is less than expected for for length in infants with Down syndrome. And actually, this proportionally does increase. So that the Down syndrome babies, they get obese between 3 and 4 years old. So they are less, they're kind of delayed with the growth, but then they get obese around 3, 4. Here's a little chart for the boys with Down syndrome. The age is 2 to 18, and you can see the lines that describes 50%, 25, 50, 75, 95. The girl said, don't go too deep, just keep going, because I like to talk. So a little quick about the other conditions that are related with the Down syndrome. So we have heart diseases, and it was amazing to see that it was 50% of Down syndrome patients have heart disease. That's a lot. It's like huge. And then all those problems, what they can have. And I pull up all the descriptions of mitral regurgitation, atrioventricular septic defect, ventricle septic, PDA, patient conduct arteries, which is the ducts are closed, and then tetralogy, it's the heart structure problems. So there's not the right structure of the heart, creates problems. GI abnormalities, we do have a lot of problems with bowel movements and stuff. 5% of the cases, we have duodenal stenosis. We have those fancy medical words. I try to bring it up so we know what we're talking about. Imperforate anus, which is opening or missing an opening or a blocked anus. So problems with voiding, and esophageal atresia, which is the absence of closure. Atresia is the absence of closure. So esophagus, heart with feeding and stuff problems. Hirschsprung's disease, blockage of large intestine, again, GI issues. That's why they getting obese and they having difficulties with feeding, and also celiac disease, 16% are related with, associated with that disease.
Was that new, the celiac disease? Is that
that's a new.
Yeah.
Yes.
Yeah.
And it started to kind of grow. The windows from 5 to 16, and the comparison to the general population. So it was interesting.
That's interesting.
Yeah.
The other thing with the obese, with the defects in the heart, that kind of how it correlates with the obesity. So in all of those, most of those defects that you listed on the heart, so the left side, the left ventricle of the heart doesn't work like it should to pump, and so it actually enlarges and it gets thicker, and the more it enlarges and thicker, then the less blood that it can pump. So when they do try to do exercise, they get really short of breath. So therefore they don't exercise, and then they're obese.
So it's all related.
Yeah, it's all kind of related. And their heart is just working so hard just to at rest, and then you add the activity to it, because you can pull up pictures online of the heart on studies, and when that left ventricle is just the hypertrophy that just comes with it just gets huge. But even though it's huge, it can't go in the right rhythm to pump. So it's they get really short of breath and deters
hard for them to move and exercise. Vision, hearing problems. So quick strabismus, crossed eyes. We've got this percentage here, 25, 57. Nystagmus, they call it dancing eyes. Lots of contractions and slapping. 18, 22. Cataract, 5%, and does increase with the age. The older they get, the more they have those symptoms. Refractory error. Hearing issue on both sides, and on one side, conductive sensory neural and mix, and otitized media is also a frequent problem. Skin disorders. Wow, I was going for this, and again, medical words. I'm like, I gotta pull up some pictures here because look at those geographical tongue. I'm like, okay, I can imagine, but I wanna see it. So that's the geographical tongue. You see like mountains, lots of deformities, structures on the tongue. It's not smooth and nice. Also here is the Fisher's tongue. So you see those deep rows going through, and what does it tell you? That, you know, problems with breathing, sensory, testing, all those things are hard for these kids. Xerosis, abnormal dryness of the skin or mucus, itching scalp right here. So, and here, the hyperkeratosis, abnormal thickening of the palms and soles. So what it tells me, they have a decreased sensory, because the harder skin, the less you can feel. So even though when they walk, they have a thick sole, they can't really feel the